So they're healing. They're getting there. They're a little more rough. They don't hurt as bad. They're getting there. I'm about to put aloe vera on it to make it a little better. I look rough. I know. All right, this is me 5 days later, I believe, after they took all those wires out. That's what it looks like. It's not as itchy no more, especially around my head. It's not as itchy. I wash my hair like 3 times now from then. Because you're not supposed to wash your hair every day with that. You can make it worse. And then I've just been putting aloe vera. Yeah, this is what it looks like now. We're healing. Hey there, good morning. All right, so today I am going to a kidney failure appointment. This is my fit. I have a bolero under with a hoodie. That way I can, put it over my head just in case it snows. So it looks like it's snowing a little bit. And I'm wearing my glasses because, well, my body can't seem to stop having reactions to things. And I scratch my cornea. So, yeah, let's go to this doctor's appointment.
Ahí está.
Más.
Así que.
Sí, casi acostado. Oh.
Casi te paró medio de frente.
Oh, my mom was here and she didn't know how to lower the bed. She kept on making me go up and sitting me forward. It was funny. All right, hi guys, feature Eunice here. I wanted to apologize of how weird this video is. Sometimes it's vertical, sometimes it's horizontal. And then I also have a clip where it's just a recording of the voice and I put a photo in it. The reason is because sometimes the medical field lets you film and sometimes it doesn't due to their own protection. But where's my protection? You know what I mean? So sometimes I do it on the down low. And yeah, so I apologize about that. But I hope you guys still enjoy the video. Back to the video. Sorry, my language. If I walk too far or right now I just walk to the car. I don't know how to explain this. It's kind of like a faint, but it's not really a faint. I have it on video if you want to see it.
Okay.
And then my body starts shaking a lot, but I'm completely aware of everything.
Okay.
And right now, since I walk too much, my body, it's not having it.
Okay.
This is how it starts. Where I went for the lab work for this supplement.
Uh-huh.
They took it, and then I started having the episode like that. And then they took me to the hospital.
I see. Okay. So when you had blood work, you had some of the shaking and weakness, and they took you to the hospital after that. Okay.
And then every time they would take blood work to see what was going on there, it would happen again. So that makes me think that it's my blood flow not going. I don't have no idea.
Okay, so you're thinking that when you get blood taken away, it's exacerbating, and they're making this note about your events around the time of blood draws.
Can I ask you for a favor? I'm so sorry.
Sure.
Can you?
Take out the small amounts of blood for blood work. It wouldn't affect circulation. It wouldn't affect anemia. And just to give you some context, again, the hemoglobin is normal in the range of 13 to 14. That's normal. We routinely have patients in this kidney clinic with hemoglobins that are in the 10 range. And in that case, people are not feeling faint or anything like that. So you're not in a range where I would expect your symptoms to be related to the small amount of blood that's being drawn. That's what my experience in medicine would conclude.
Yeah. I take, yes, I do take this.
Okay, and then sertraline, and then a topical steroid. Problem even before the kidney biopsy.
The cost, the original cost?
Correct.
They never figured it out.
Okay, so you were never given names like minimal change disease or something called focal segmental glomerulosclerosis. Yeah. So that's kind of what we're looking for with the kidney biopsy. Those are really the two main possibilities on the cause of your kidney problem. Again, minimal change disease or focal segmental glomerulosclerosis. Now, there are other possibilities as well, and that's one of the main reasons we were doing a kidney biopsy, looking for something other than minimal change disease or focal segmental glomerulosclerosis. If it's focal segmental glomerulosclerosis, we generally, your protein started coming back. In your case, especially with all the medicines that you're on, I would like to give you rituximab again.
I was hoping for that answer. Yeah.
Okay, so that's where my thoughts are in terms of your treatment steps. I'm glad to hear that you're aligned with that game plan. So let's go ahead and make that happen. Okay.
Do you think every certain years? I've noticed in my life that I relapse every 4 to 5 years. Is that normal, or is that's just my body?
I mean,
the medicine
FSGS acts a little different with different patients, and it's common for it to come back. But some patients go without recurrence. Some people have recurrence less than yearly, like every 8 months.
Yeah.
So it really varies according to the patient. The fact that we got 4 or 5 good years without the protein coming back after rituximab leaves me to believe that we'll get a similar effect this next time as well.
Do you happen to know how many doses I'm gonna need, or?
I'm gonna give you 2 doses, which is a standard dose for somebody who we're treating with this condition. Again, that's very standard dose. Okay, that should be it.
That should put me back to remission.
I believe so. I can't say that with 100% certainty, but I have a high, it worked before.
It was really good.
It worked for about 4.
So hi guys, I just literally got home from my counselor's appointment. Yesterday when you saw the appointment where I went to my kidney doctor, there we talked about essentially new medicine that they're gonna want to put on me. They were thinking about prednisone, another one, I don't remember what it was, or an infusion, which is rituximab. I've been on prednisone, I don't like it at all whatsoever. It has damaged my mind a lot in my body. So I didn't want that. As soon as he said that, I'm like, no, we're not doing that. And he's like, okay, that's good, because I didn't want to put you on that. I want to put you in Rituxan. And I had rituximab like 5 years ago. I pretty much know how it feels. How it went with me is that, yes, I'm a little allergic to it. Would you call it a little? I don't know if you call it a little. I'm allergic to it because my throat started closing up on me last time I was in it. So I told him that, and he's like, okay, we're gonna have things ready for you just to be precautious, right? I said, good. And then he also made me sign the waiver, of course, because this is strong medication. And he said things that can happen is allergic reactions, and worst case scenario, it can kill your brain. I'm like, oh, I never heard of that before. That's pretty good to know, which scared me a bit, but he did say that he's never seen that before. I said, okay. I signed because I had it before, and that's the best medication that's helped me as fast as I could. And then a week before that, I was in the hospital. It was a neurology where they were trying to see if these episodes, I'll insert a clip here, they were thinking it was epileptic, and I said, no, this is not epilepsy. This is something else, because I'm fully conscious. The doctor said that there is epilepsy where you're fully conscious. And I said, I'm pretty sure this is not, because I'm good at reading my body. And yeah, it was an epilepsy. And now I went to my counselor. I haven't been able to go to my counselor in 2 weeks, and it's been a little rough because how everything is going down, being in and out of the hospital, getting all these news, which the good news is that brain waves look really normal, as best as they have been, but there's a downside where I'm forgetting a lot of things, even more now. Yesterday and the day before, I went into my parents' house and I could not remember the password. I had to call my boyfriend for the password. So I seen that. I seen moments where I ask again in the same couple minutes later, being like, what did you say? So I don't like that. And that scares me a bit. Well, with that, at least it's controlled, With my kidneys, they're about to get controlled here in he said I'm gonna have the infusion in about 3 weeks, and then after that he's gonna do a blood work test to see if they're getting better or not. So that's good. And it does turn out that I do have FSGS, which is, I'll put the information here so you can know a little more about that, which I knew that already. He just wanted to make sure that it wasn't evolving into something else when he did the biopsy. And I have some recording, I can put it in here.
There was a moment last time where I was getting it and my throat started to close on me. So I guess I have some kind of allergic reaction to it. But
Okay, we will definitely watch you during the infusion. When we give you the infusion, a nurse is there the entire time.
Okay.
And if there's any infusion reaction, I'm looking at the notes from your last infusion reaction. Yeah, you had some nasal stuffiness, itchy, tight throat, rituximab was stopped. They gave you some steroids.
Okay.
And then we also give like a Benadryl. And so those are things that we do to reduce the chance of this progressive allergic reaction.
And the Benadryl won't hurt my kidneys more?
No.
Okay.
Okay.
All right.
All right. So let's plan to do that. I'm just going to tidy up a last couple of things here. And it looks like you're not thrilled about doing vaccines. You don't want a flu shot or anything. Is that correct?
That is correct.
Okay. All right. So I'll arrange for the rituximab.
You know how long it's going to take? Or?
It will take about 2 to 3 weeks.
2 to 3 weeks.
Yeah. And I'll even put in here that progesterone injections are one idea to consider. To be frank, they also have side effects. You know, some people get weight gain, some people get acne, but those are not always the case. I want you to talk with women's health doctors about your options. Please do not get pregnant, okay?
Actually, that's a good question. Whenever I want a baby and I happen to want a baby, that's always been a fear of mine, my health and the health of the baby as well.
Yes.
Would my health go down as well?
No, I mean, from a kidney standpoint, I can't speak to the seizure history and the other things, but when you're in remission especially, and I believe we'll get you there, you're safe to have a baby.
Okay.
Okay, so I'll just put it like that.
Is there any way I can get off Jordans?
If your proteinuria or the protein in your urine gets better, yes.
Okay.
But for now, keep taking it. And then once the protein comes down, we will try and get you off. Okay? I'll be right back. So we're going to discuss rituximab. You've gotten it before in 2019. The main risks of rituximab are that it weakens your immune system. That is a known side effect of this medication, which means that you're going to be at higher risk of developing all infections, like urine infections, flu, those sorts of things. That's why we suggest vaccines. I know you're not thrilled about that idea though, okay? And then the infusion reaction, just like you had during your last infusion, you said you had some sensation about your throat. It looks like the second infusion went okay though. Remember again, a nurse is with you during the entire infusion. If there is a reaction, they'll either stop the infusion or just slow it down and give you things like Benadryl, antihistamines, or steroids, okay? And rarely you can have an infusion reaction that happens even weeks later, which shows up like joint pains. Doesn't really cause problems with breathing or anything like that. So those are risks to be aware of as well, okay?
Is that something I come back to you about and tell you?
Yeah, if you develop that, we certainly want to hear about it, okay? Now, the worst case scenario that I have to explain because it's on the label for the drug is a weakened immune system that causes an infection of the brain that can be permanent, okay, and cause permanent brain damage. I have never seen it, okay? It is rare, but because it's so severe, the FDA says we have to explain it. Okay.
What's the damage essentially?
It's a viral infection of the brain that causes permanent brain damage.
Sorry, that just scared me a bit because I have seizures.
Yeah, it's a scary thing to say, but I'm required to say it. But I always come back and say, I've never seen this. Okay. And I've given a lot of this medication.
Well, I guess I've done it before too. So.
And you've done it before, so if you feel comfortable and you feel like your answers to questions have been adequately answered, then we can move forward. And then I'm going to see you in about 4 months, but I'm going to get labs on you in 2 months so that we can see the response to treatment, okay?
In 2 months? Okay.
2 months lab, follow up with me in 3 months.
Okay.
All right, let's save that and we'll get you moving here, okay?
The side effects of that medicine is so strong.
Prednisone you're talking about?
Yeah.
Yeah. That's why I don't want to give it to you, and we'll do this alternate route. Okay?
Thank you.
All right, my nurse will be in here to check you out, okay?
Thank you so much.
You're welcome.
Thank you.
You're welcome.
And now to my counselor. So I went to my counselor. My boyfriend was there with me, and it was a hard one, like a really hard one. I am very good at knowing my thoughts, my body, but because of all the trauma that I have had, I no longer trust my mind when something bad is happening. I'm gonna go a little deep into this, but I don't know if this has happened to you guys. When I was little, people would tell me, you're okay, you're okay. And I've been sick since I was 7 years old, just to be a little frank with you guys. I've done this for quite a few years, but to this day, they still tell me you're okay. And I think that damaged me a lot. Our family members and so on, they would be like, you're just overreacting, that's not true. And doctors would be like, no, you're fine, when I could feel something in me was wrong. And it wasn't until worst case scenario, or almost close to death, that they would help me. I don't know if I talked about this, but I'm having trouble sleeping now. As in, I am sleeping, I'm sleeping a lot more. Like I sleep all night, 8 hours, and then I wake up, I take a nap, wake up and take a nap, and then go to sleep. That's how my body's doing now. I'm letting it rest. But every time I'm about to go to sleep, I have an immense, like a lot of anxiety, where I have to put headphones on, to put music on, or sleep while my phone is going, I'm watching TV, because I'm so scared. That fear comes from the amount of times that the medical system failed me since I was little. And if you guys want to know more stories, please let me know. But this last time, my last relapse was in 2018, and I kept saying something's wrong, I'm about to faint. And they didn't believe me, and it wasn't until I was down that they came in rushing in. And when, those of you know, when they're rushing in, it means something's really bad. When the alarms are going, it means something's really bad's happening. And they say your room number. And I remember I just fell into my brother's arm and almost passed away. My heart rate went all the way down to 28. So I almost died, because that one nurse didn't believe that something was happening. Like I said, I know my body. The system is just very broken. So I'm having trouble sleeping now. My anxiety is up. I don't trust doctors. I keep asking a million questions for that same reason. Especially right now that I truly believe something's going on with my heart. In my iWatch, I know doctors don't trust the iWatch, but you can see it jump in it like a lot. Little things make me want to faint. I'm just sitting now. And that's one of the things that I was asking the counselor. I'm like, how do you trust again when somebody failed you? And at the end of the day, he said, you have to trust yourself, Eunice. And there was a point where he really hit me, and I got angry. I'm like, I don't want to fucking talk about this, but I was able to bring my ego down and talk about it, right? I just started crying really hard. He was saying, what are you afraid of? And it goes down to people not being there at the end of the day when I need them. People not showing me love, and if they show me love until I'm almost dying or in the bed in the hospital. And that came from, because I finally told them that my mind is addicted to being sick. And I started to notice that like maybe like 10 years ago, where I would find myself imagining moments where I was sick in the hospital and people were around me saying goodbye as I was almost dying, or just showing me love. And I said, this isn't right, what the hell's happening? But I've always been too ashamed to talk about it. So I told them about that, and that's where it came from. It was like, and it comes down to, I just want people to show me more care and be compassionate and understand me a bit. And he said, Eunice, we're never gonna be able to understand you because we're not in your shoes. And he said, I'm sorry you're going through that, but this is very good that you're opening it up to this. The fact that your mind is thinking these, but I don't want you to say your mind anymore. I want you to say the mind is addicted. The mind always has addictions like that. And knowing how to control those or how to own that part, you will be able to heal from that, or kind of heal, because there's always demons, right? And I just started crying really hard. Again, my boyfriend was there, so he was holding me. But I was really angry out of all that. Where it's like, what the fuck happened? What did I do to deserve all this fucking pain? And then my mind getting addicted to that pain. And the reason I get addicted to the pain is because, after I go down, I gain my power back, where I become my strength comes back. Like, my mind says, I did that, I overcame that, I can overcome anything. And it's just so interesting how the mind works. Like, I don't know. And the sad thing is, like, I don't know if I triggered my relapse this time because of how much I was going through. And saying if I can overcome my health condition, I can overcome anything, you know? It's just so weird, interesting, and toxic about me. And I don't know, I'm trying to learn how to stop that. And I asked him, how do I know what I'm feeling in my heart is true or not? And he said, you have to connect with your soul, Eunice. You have to be able to understand your mind and what it's saying. It's like, so you have to sometimes take a deep breath and go back to basics. What can I do today to make myself feel better, help my body? But inside of me, I truly, truly believe that something's going on with my heart. I remember there was a moment where he was saying, it was like, dance, and I'm like, I can't even walk a lot anymore. I need help. And he said, you can dance sitting down. And then my boyfriend said, she actually dances while she's laying down on me. Like, I put my feet on top of him and we're home dancing. But yeah, that was just such an interesting conversation that I finally let it out. It's one of my most toxic traits, how my mind is just so addicted to it. I've always been ashamed to talk about it, just because it wants to gain power back afterwards, or it knows that I will gain power, my own power back, my own strength, or my own strength of character, if that makes sense. It's really hard being sick and people not fully understanding you, just dismissing you. And I asked, how do I communicate or talk to the doctors to please listen to me if something is happening? Because that triggers my anxiety, where I'm like, oh shit, I might die. And I don't want to die yet, because I have family members, friends, my boyfriend, his family, that I still want to interact with them more, right? And his response was like, you have to make peace with the fact that it can happen. Everybody's gonna go through death. And I said, but I don't want to end up mad. I'm angry right now with everything that's happening. I'm angry with even people that don't understand what's going on, and they're blaming their angriness at me, if that makes sense. Like, sometimes they treat me really bad when they're like, you can do it, you're just making this up, or like, you need to get up. But in reality, I can't even get up, and they're not understanding that. So I get angry in that, and I'm getting away from that. But I'm scared that if I don't make it this time, I want them to know that I love them. And that's just very hard to comprehend in my mind, or know that I need distance from toxicity like that, because if not, it stresses me out more. But I still want them to know that I love them and I'm there for them. And just all these things that my mind is addicted to, the toxic part of that, you know, that at the end of the day, you come first. But also, like, fuck, you care for those people. But you also have to take care of yourself and notice those, I think, things that the mind is addicted to, you know, the toxic part of that. I've never been able to actually talk to people about it until him. I'm glad my boyfriend was there. He actually knew about it already. But just those thoughts when they come in, whenever I'm having trouble, like, even, I kid you not, when I'm down in the hospital and something is happening, when they're doing tests and for seizures, you have to press a button so they come in and they can see if it's a seizure or something else is happening, so they check the waves. And even then, I'm like, oh, I didn't press it because I didn't think it was that bad. When they're like, I want you to press it. Where my own mind is telling me, no, you're fine. But then the doctors are saying, you're not fine, you need to do it. But it goes back to that, the trusting that a doctor's gonna trust you, that you're saying you're not fine instead of them pushing you away. So you yourself push it away, and it's just so contradicting with that, you know, because you're like, they're not gonna believe me, why do it? Or, it's all in my head. It's just really hard. Hopefully I'm making sense with this. I'm not sure if I am, but that's where I'm at right now. My counselor wrote me a letter that he wants me to practice every day, and I'm gonna read it to you. I am addicted to relapse. Guess it rebuilds my power and it keeps me connected. I want to stay strong and to free out of this. And then in the back, it's like a positive reminder for me. I command my mind to love and relieve my body. This is a gift. Essentially saying this is a gift for myself. What that's saying is that I want to connect with my mind and my body both at once so they can make peace with each other, because my mind essentially is very angry at my body for being different. See, thoughts get started to come in my head, but I guess you can't see them, right? But I said broken, and I was trying to make it into a positive one. So that's what I'm trying to do now as I work through my body, through my relapse, and understanding it a little more, and I guess putting my brain into a positive one. And it doesn't help that I have, like, I don't know if this is an excuse, but that I'm taking 12 medications now. It's about to be 13. And I can feel the negativity coming in. Like, one of them makes me eat a lot. And I'm trying to eat slowly so I don't eat so much because I'm noticing it. And then I have another one that I can tell negative thoughts are coming in again, where I just want to, like, protect myself instantly. Like, find fights for no reason. And I just need to find that peace within myself, or it's like, why bother to fight if it's not broken, or it's just a little thing, like the littlest fucking thing ever, and I fight for that, you know? Like, everything, I want everything to be perfect, and I want everything, essentially I just want control, because I need to be ready for worst case scenario. That's what my mind wants, because of the amount of trauma that it has. And I need to learn how to let that go. I hope this helps somebody out there that's going through the trauma of either abuse or a health condition that you're going through. I just want to say you're not alone. And the addiction of the negativity that your mind is so used to, and fighting through that, you can do it. I know you can, and I know I will be able to do it too. Oh, I just got a negative thought. Like, my negative thought was like, yeah, once we get through this, we're gonna be powerful. But my mind needs to understand that, or the mind needs to understand that I don't need to go through this to have my power back. And I guess that's my message to you. You don't need to go through negativities so you can have your power back, or who you are, your soul, who you are personally back. You have it in you. You just have to break through those barriers, or that fear of not being loved or getting mistreated. We got this. We'll be okay. Own your power. I love you.